live?
Yep.
Good. Good afternoon, everybody. Happy Sunday. We are here live again with our Sheriff, Health Officer, and Director of Health and Human Services to answer your questions. So first, I just want to let you know that we do have our information call center. It is open from 8 to 5, and the number is 209-239-1332. There's also a recorded information line at 209-966-1133. And you can always send your questions to our email address, mariposacovid19@gmail.com. So with that, I will go ahead and get started. Let me get it on my computer here. It's not showing me yet.
Right. Do you want us to go ahead and just
Yeah.
do a quick while you're starting? So good afternoon again. I'm Eric Strzyanko, the County Health Officer. So what's happening with COVID-19 in the world, in the U.S. and in the state and here locally? Worldwide, we're over 300,000 cases. The most active area outside of the United States is Italy, remains a hot spot. Within the United States, where we're really seeing things take off is in New York and New York City with over 12,000 cases. And then here in California, we've got a total of just over 1,500 cases with 28 deaths. In the San Joaquin Valley, there's activity in San Joaquin County itself. They have transitioned from containment into mitigation, but the rest of the counties within the San Joaquin remain in containment. Calaveras has a small cluster of 2 cases that's being investigated. And then you may have heard of the 2 cases in Madeira that we were helping with on Thursday and Friday. Great story there where the Sheriff's Office in Madeira, along with their probation and DA investigators, assisted the Madeira County Public Health and were able to do 150 contact tracings in a single day, shut down that chain of transmission where we were really concerned about getting sustained community transmission in the San Joaquin. We were able to shut that down. So here locally, again, still no cases. We have 22 tests that we've conducted. 12 of those are pending and 10 have returned negative. So that's kind of the snapshot of what's happening here with COVID-19 from this world down to local level. Sheriff?
Great, thank you, Doc. Well, good afternoon, everyone. My name is Doug Benoist. I'm the Mariposa County Sheriff Coroner. Thank you for joining us this afternoon. So I want to give you a quick breakdown on what's occurring currently with the Sheriff's Office and how it's playing out with our COVID-19 response. So as you know, the Sheriff's Office is responsible for providing many services to our community. One of those I just wanted to clarify is our responsibility to coordinate the Office of Emergency Services for Mariposa County in conjunction with our partnering agencies in the county. And the primary responsibility of OES, Office of Emergency Services, is to plan for, respond to disasters such as this COVID emergency, and also plan for and implement recovery activity. Part of the OES mission, we have what's called the EOC incorporated within that. That is our Emergency Operations Center. Now, why I'm sharing that with you is I just want to share that Mariposa County government has identified this COVID-19 response as an all-county response. So basically what that means is that all of our local county resources and experts and personnel are capable of being reassigned and prioritized and services streamlined to support our all-county COVID-19 response. That's largely being coordinated through the EOC, and we're working very closely with our partners, especially Mariposa County Public Health and their DOC. I just share that with you because a lot of this activity occurs out of eyesight, but we have many great employees, experts at all levels, literally working many days in a row, many hours a day to ensure that we are able to enjoy the best outcome that we're striving for as a county in Mariposa County. So I felt that was appropriate just to give a shout out to those folks that, again, are working day and night to protect you, your loved ones, and we're looking forward to a good outcome. So along with my agency, the Mariposa County Sheriff's Office, we've implemented many protocols and procedures to support this response. We have three primary divisions. I won't go too deep in the weeds, but our correctional facility has implemented our pandemic protocols. So there are many procedures in effect there. Our public safety division has been continuing to do a great job, of course, and I don't suspect you'll see really any change in primary emergency response or community assistance in that division, meaning your uniformed law enforcement deputies out on the street day and night are continuing to be out there and responding to your calls for services as needed. I did want to touch a bit on our JIC Center, our Joint Information Center. It's, considering, and we've learned this through history, especially with our fast-moving wildfires in the community, that it's paramount that we get that accurate information out to you quickly. We understand that it's incumbent upon us to get the information to you as quickly as we receive it and ensuring it's accurate to you. This helps at many levels, and we have many people coordinating this information flow from government to you. Just continue to take advantage of our resources like this, such as Facebook, our Everbridge, Nixle alerts, our Sheriff app, and our partner agencies avenues the information to you also. So again, we're trying to get that information out to you. We hope you can receive that and make us aware, of course, if there's any disruptions, so you're not getting the information you need. I suspect we may hear some of that from this ask and answer session today. I'll wrap up. I just wanted to share a little bit about the stay home order that has affected our countywide, and really something new for all of us as a community. Obviously, we're all aware the governor's orders, the stay-at-home orders, along with our local public health officer stay-at-home orders, are primarily to protect our community, slow the spread of COVID virus, we've all heard, lessen the curve. This is very important. And the point to that, by limiting our unnecessary exposure to others, is to lessen that impact to not only our vulnerable population, but our entire population, to do our best as a community, as a team effort, to lessen the number of seriously ill, so we do not overload our healthcare services. This is the primary mission of the stay at home. And so it is working. As the doctor just shared, we continue to not have any local known cases. There are known cases outside of our county and other jurisdictions, but we are seeing positive effect at this time for your actions. So I just wanted to give our community a shout out. Thank you for understanding this request and the process. We understand the hardships, but it's working at this time, and we do feel like that you should be recognized and recognize that your efforts are playing a huge role in how Mariposa County comes out of this emergency. Before I wrap up, I know there's been quite a few questions about what does a stay-at-home order mean for me, the Mariposa County resident. The governor's office has articulated that well. Our PIOs have articulated that, but I just want to confirm that we are asking non-essential businesses, people who are able to stay at home, please do that. Lessen your contact with other people. Pay special attention to personal hygiene. Wash your hands frequently, and we are seeing success with this. The sheriff's office is not stopping people to check on why you're out or where you're going. We're still out there to make sure you're okay, but you don't have to worry about us red lighting you to see if you're doing essential or non-essential business. This again is just really important. We want you to maintain your mental health. You need to get out on walks if you can and exercise, walk your dog, throw a ball with your family if you can, but again, really pay attention to social distancing and the other protocols that have been requested of public health. So I'll wrap up. You're doing great. We've got this. We're gonna look back on this and be really proud of our response. So thank you. Siobhan?
Great, thank you. So Siobhan Katari, Health and Human Services, and the role that I'm playing in the event is the director of our Department Operations Center, which is really looking at a number of things. First of all, we have a public health team who is very well prepared and well trained, and we're bringing in folks from other departments and giving them the tools and resources they need to be supportive in this effort for us to be able to do monitoring and contact tracing, as Dr. Sergienko talked about. So that's one of the big roles of the Department Operations Center. Additionally, we're looking at maintaining all of our essential services in the county. So looking at things like behavioral health services or public assistance services. So all of our services, even though our lobbies will be closed, are remaining open to the public. We know now more than ever, as folks are unable to get to work, they may need some of our supports and services. And so by contacting our department, 966-2000, and Christine is going to be continuing to share more information about where you can call. We are on call. We are ready to assist you, even though we'll be using more innovative strategies, technology, telephone services, online services to support you in your efforts. I also wanted to let you know that we are putting together resources for food distribution. And so we already do programs such as the Meals on Wheels for seniors. And what we're doing is we're ramping up efforts, knowing that folks, especially folks in our vulnerable communities, are being asked to stay home and to keep themselves safe and healthy. We want to make sure that everyone has the resources, the food, the medications, and the care and support that they need to be in their homes safely. And so we are here to respond. You can call our number, call the helpline, or 966-2000, and we'll respond. We'll bring groceries to your home if that's what's necessary. And we will be working on and releasing information this week about food distribution areas, places that you can come, drive up, grab some food if you need it, hot meals or groceries, and also distribution sites such as partnering with the schools to make sure that we're getting food out to families and to kids who are home and off of school right now. We know that as folks are quarantining themselves or self-quarantining, or they need to sequester themselves for various reasons to keep safe and healthy, that sometimes they're not going to have the capacity to do this in their own homes. And so we're partnering with hotels and looking at ways that we can help people to isolate when that becomes necessary. In addition, I know that a lot of people will be losing income as a result of having to not be able to go to certain workplaces. And so we're working with the EDD and other services to see how we can best help support you in getting your unemployment insurance as quick as possible. And like Sheriff Benoist said, we have an eye towards recovery. Like the previous disasters that we've all participated in, we want to start recovery now. We know that individuals and families and businesses are going to need our support and help. And we're going to partner with our private sector partners in the business community and see whatever resources we can bring to Mariposa County to help us heal and to help us recover from this, because we've shown we're a resilient community. And like Sheriff Benoist and Dr. Sergienko says, we feel that we've got this crisis under control, and we're going to definitely do everything we can to start recovery now. Thank you.
Okay, thank you. We'll start with our first question. It comes from Danielle. Danielle wants to know what type of tests are being used and how are these tests performed?
So currently the tests that are being performed are called PCR, polymerase chain reaction, and that's looking for the DNA fingerprint of the virus as it occurs in the body. And so those tests are available both through our public health lab network and through commercial labs such as Quest. So how does that translate to testing here in Mariposa is you have to go to a provider that will use a swab that goes way back in the back of your nose, and they get that specimen, put it into what's called viral transport media, and it either gets shipped off to the San Joaquin Public Health Lab or the State Public Health Lab, or to the Quest Lab in San Juan Capistrano, and they put it on the PCR machine. And once it's on the machine, it really only takes about 4 hours to actually get that test performed. But here's the big kicker, is that when we lifted the restriction on sort of screening for criteria before getting that test, is now any medical provider can order the test and send it off. This has created a backlog of anywhere from 6 to 10 days in the commercial labs. So what we've been doing is, if there's someone who is truly sick and needs to have that test done as a priority, is we ask the provider to reach out to the health department and discuss the case, and then we'll prioritize it to the public health lab, and we can get turnaround on those in 24 to 48 hours. So again, same test, and can be done in the clinic as long as they can do what are called personal protective equipment measures. And at this point, the only place that I know of that will do that in the county is John C. Fremont, but there are other clinics outside of the county that you may be seeing as a primary care provider that will get that test done for you.
Thank you. All right, the next question comes from Barbara. She'd like to know, how is the request for ventilators going? Do we have a place in line to receive any from the Strategic National Stockpile?
So good question about the Strategic National Stockpile, or SNS for short, and I'm sure you're going to be hearing more about that later. That's a federal program that's administered through the Assistant Secretary for Preparedness and Response. And currently right now, there's actually very few assets moving from the SNS into the state of California, and they're queuing up those resource requests for when they're needed. I will say I heard today that there is going to be a 50-bed federal medical station that will be deployed to Fresno. The details on that are evolving. But as far as ventilators, specifically ventilators here in John C. Fremont, is that we have 3 ventilators, and then we're planning on expanding that up to 5. And we'll either do that through private vendors or through the Strategic National Stockpile.
All right, thank you. The next question comes from Don. He would like to know, can one of our local breweries, wineries, distilleries make hand sanitizer?
I don't know. Again, it would need to be at least 60% alcohol and be able to be in a gel form. So I actually don't know the regulatory or I know you could do it, but whether it's be within regulation or not, it was something I'd be defer to the sheriff for.
Yeah, we'll have to look at it. It's a great suggestion.
I actually did see from one of our state associations some guidance come down about mixing vodka with aloe vera gel and certain essential oils as a way to make do-it-yourself sanitizer. But I don't know.
But again, you need to be licensed as a distillery rather than as a brewery or a winery.
Mm-hmm.
Trying to find out more.
Yeah.
Thank you. All right, the next question comes from Suzette. She'd like to know, why are some non-essential stores still open?
So I'll take the first crack at that and then defer to the sheriff for the more. But at this point, again, we have no cases in Mariposa. So I think we aren't really at the point where we need to be very strict about closures. I would like to see people comply with the state health officer's order, but recognize that, again, that came out Thursday night. Friday, there was a lot of just, let's call it sticker shock or just what the heck's going on with this and getting clarity on what's essential and what's not essential. So the public health branch of Health and Human Services, along with the sheriff, have been doing some education on that. And I think we'll gain compliance with the state health officer's order over time as we're able to reach out to people and educate more. And again, we appreciate the community stepping up and letting people know that, hey, there is that state health officer's order out there, and asking their neighbors to do what they can to decrease the spread of disease.
Yeah, thank you, Doc. I'll just add in a little bit that we are aware of this, and we appreciate the community's awareness and concern. Like the doctor just shared, I mean, this is a a whole community sport at this point. So everyone jumping in to do what they can to comply and assist us with this mission of lessening unnecessary contact is going to assist us in the future. And this is dynamic. Prior to a few days ago, this was a week to week to a day by day. And then on Thursday, this turned into an hour to hour dynamic event. Enforcement regarding compliance could change. It could escalate depending on what the doctor just shared regarding our local situation. Right now, we don't have any confirmed COVID-19 cases. However, that could be a trigger, as well as a case of, concerning community spread on or near our county borders or inside, to escalate enforcement, seeking compliance for that. So it's kind of dynamic. Siobhan articulated for the group, for the county, we understand and comprehend the economic impacts that this county, our business owners, are experiencing. It's going to be significant. We understand that. We sincerely appreciate the community's compliance and support for our current mission, because it really could save people's lives. So thank you.
All right. A lot of people are asking about masks. Can we just talk about when to wear a mask and when not to?
Sure. I mean, again, the current guidance from the CDC is to only wear masks if you're symptomatic. And the idea behind that is masks really only protect other people. If you're coughing, sneezing, breathing, you're breathing out those droplets that contain the COVID virus or any other virus like influenza. And by wearing a surgical mask, you contain those droplets between you and the mask, and they don't get out into the world. On the other hand, they're ineffective filters, so the virus can get around the edges of that mask, and you would not be protected if you were not infected already.
Thank you. Next question comes from Penny. She would like to know, why are we allowing visitors to hotels and vacation rentals when this can affect residents?
So again, I think it gets back to what we're talking about with the state health officer's order, which is to shelter in place or stay at home. And we recognize that there are some people who got caught out in the middle of their travels without any forewarning. This was not something that we were expecting for a statewide health officer order, nor do I think travelers were anticipating it either. So there are people out there who were caught unawares, and we have to appreciate and respect that. But again, at their earliest convenience, trying to get them back to home, I think, is probably the best thing for them.
Okay, the next question comes from Ariane. She would like to know, is Mariposa County preparing any field hospitals or hotels for large numbers of residents if they become sick, in case Merced and Fresno hospitals can be overwhelmed?
Totally. Is that at this point in time, I've got at least 2 of my team members that are working with John C. Fremont on what we call surge planning. And again, if you remember, some of my YouTubes I talked about, we're in containment right now, then we move into mitigation, and then we move into surge. We're already planning for that surge phase, and we would be setting up alternate care facilities. Again, the initial intent would be to increase the bed space at John C. Fremont to keep people as close to the lab services and other ancillary services that are available at the hospital. But if we exceed those capacities, we would be looking at other spaces to place people in that would need minimal care.
Okay, thank you. The next question is also from Ariane. She'd like to know, are false negatives common with this test?
So that's a good question. At this point, we feel the test is fairly reliable. And so the chances of there being a false negative are fairly low. But I will say, again, you have to do X number of tests and really know what the denominator and the numerators are. So there's a lot of numbers that still need to be gathered to let us know what the true false negative rate is. Okay,
the next question is from AK. They would like to know, will we be limiting travel by county staff, those staff that live out of Mariposa County, that will be interacting with the community as individuals deemed essential staff? Is having this group come in and out of the community in the best interest of our community members?
So I'll take that as, again, what we will likely start doing in the next couple of days, and I know we're going to start doing it as the Health and Human Services Agency, is we will do employee screening. And really, we do care where you come from, but we want to ensure that all of our staff are healthy when they come to work. So we'll be looking for signs and symptoms of COVID-19, including a temperature screening. And I think that will reduce the risk. We do know we've got staff members that come in from counties that are outside of the area. And we just, again, feel like just screening everybody is the way to go with the approach here.
And just to add to what Dr. Sergienko just mentioned, to the greatest extent possible, not only in Health and Human Services, but throughout the county, we're looking at telework options to the extent that folks can do the essential services from home, such as process public assistance benefits, for instance, or do telephone counseling. We're having them do that. And then only those folks that are really required to be physically on site are we asking to come on site. Once again, it's taking us a little while to ramp up, but it's really a good opportunity for us to look down the road into the future as to what telework can do for our communities overall.
Okay, thank you. The next question comes from Barbara. She says some communities are taking school meals on school bus routes and delivering at bus stops. Has this been considered for Mariposa? And is there emergency funding for bus fuel to provide this service?
Yeah. I can take that. So we are in discussions with the schools on a regular basis. Right now, they've begun to distribute meals at various school sites throughout the community. They're distributing meals between 10:30 and 12 in the morning at most of the school sites, and you can find that online, or I can share that information. Basically, right now, what we're looking at with them is possibly distributing groceries on the bus routes as well. So the schools would take the buses around to the normal bus stops, distribute meals to kids, and we could distribute additional groceries to families as well. So we're putting some plans in place for that to happen, so more to come on that. And in terms of funding, there is disaster funding that will be available. We're learning every day. There's new resources coming out that we're digesting, and everyone on our county team is looking into all available resources right now so that it has minimal impact on our services.
Thank you. Mm-hmm. Okay, this question comes from Carla. It looks like she's reading about containment versus mitigation. She wants to know, what is our county going to do to help encourage and contribute to containment versus mitigation?
So containment is a whole of government activity, as Sheriff Benoist said. So we have got augmented staff from sheriff, from probation, from the DA. Those are skilled investigators that use the same skill set that communicable disease investigators and public health nurses do. And instead of tracking down bad guys, they're using those skills to track down contacts. So when we have a positive test, we will isolate that person who has a positive test and then use our contact tracing team to go out and find the contacts and then quarantine them. And just as a point of reference, if someone does get quarantined, they're quarantined for 14 days, which is the longest we know the incubation period to be, unless they develop symptoms, and then they will be tested as well. The person who has been tested positive will be asked to stay in isolation for 7 days from the onset of symptoms or 3 days after the fever has broke without any anti-fever medications. Those two actions, quarantine and isolation, will break the chain of transmission. And by having the augmentees working with the public health nurses, we can more rapidly do that contact tracing and stay in containment phase.
All right, thanks. Next question comes from Patricia. She would like to know what is going on with online schooling for students.
So I can take
Sure.
that. So we're, like I said, in conversations with the schools, and I know they used last week to really ramp up their efforts to get ready for online schooling. We're hoping to hear more this week. I know they're anxious to get resources out to the families and the kids so that they can continue their learning process. So more to come on that, but there are plans being built right now for online schooling, as well as sending home packets to folks who maybe don't have internet access at home. So that's always a concern. So for families who don't have internet access, we need to ensure that those kids get the resources they need to continue learning as well.
All right, Susan would like to know how many have been tested and we don't have test results back yet. And are those people staying at home or in the hospital?
So we've got 22 tests that we've done total, 12 of which are pending, though we may have gotten some back between, that was the morning report, so we may have already gotten some back. But those people who have been tested at this point in time are quarantining at home. We did have initially a couple of hospitalizations, but those tested negative, and they have since been discharged and come home as well.
Okay. Next question comes from Andrea. She would like to know, if someone is caring for the elderly, what advice would you give them to help keep the elderly safe?
So the same sort of things that we would ask everybody to do. Good hand hygiene, hand washing is important. Staying away if you're sick, and actually being very conscious about what those symptoms are you're looking for. Maybe even taking your temperature and making sure you don't have a fever while taking care of someone at risk. Looking for that deep cough, the cough that's in your chest rather than upper respiratory, and then shortness of breath. Those are the key features of COVID-19. If you had any of those, I would consider not taking care of your loved one. And then also preparing them for sheltering in place, even if they don't have support. So making sure they've got the medications they need and shelf-stable products so that if you were to take ill, that you would be able to stay away from them.
And I'll just add, please don't hesitate if you find yourself in this situation and you're unable to care for a loved one. Please don't hesitate to call us at 966-2000. We want to ensure that all of our community members receive the care that they need during this time. And if you don't, like I mentioned earlier, have a separate place to stay and you need to stay separate from a loved one who may be vulnerable due to age or due to an illness, we're here to help. We're ready to respond.
Yeah, thank you, Siobhan, for adding that. I just also wanted to share with the community and prepare them when and if and when they do rely on emergency services response, whether calling on our 911 emergency lines or the other response support lines. You may notice that you could be asked additional questions specific to this COVID-19 response. So just anticipate additional questions regarding the person's condition, and again, questions specific to fevers, illness, things like that.
Thank you. Next question's from Dina. She said, on the COVID-19 daily status report, you have total pending tests. What exactly does that mean?
So that means the total number of tests that are pending. So,
I don't have it.
so what that means is that they've been collected, they've been sent to the lab, and they're sitting in a line somewhere in the laboratory. And so, as I mentioned somewhere, is that when we kind of freed up the restrictions on testing, is that there were a lot of tests being ordered, not just in Mariposa, but throughout California. And that overwhelmed the laboratories to where they went from a 24 to 48 hour backlog to a 6 to 10 day backlog. So when we say those tests are pending, they've been collected, they've been sent off, they're in a line somewhere in one of the labs, either at a state public health lab or at the Quest Diagnostic Lab in San Juan Capistrano.
Okay, thank you. Next question's from Jessica. She'd like to know, can pets contract COVID-19?
Yes, they can, but as best we know, there's very, very limited data. We have basically case reports on a couple of dogs. So we know that dogs can carry it and that they can shed it in their feces. But we don't feel like they can have onward transmission of the disease from the pet back into the owners or to other humans.
Thank you. Next question is from Cindy. Any idea how long we are going to be on lockdown?
Actually, at this point, I can say that we have an idea that will be at least through the end of April. That's sort of the guidance that we've gotten from the governor's office. That said, we are having discussions with the San Joaquin Valley Public Health Consortium and trying to figure out how we can possibly shorten that or modify that in some way, because we recognize the impacts that it has on our society.
Okay. If you cannot telework and are being sent home, are you still getting paid?
Yeah, so what I'll just say is that there's new guidance coming down every day from the federal government about how to pay county employees. And I'm just talking specifically right now for county employees. There will be new guidance coming out tomorrow morning to all county employees that you'll be able to access so you understand how this works. But essentially, the goal of our county is to ensure that nobody goes without pay. We are doing the best we can to create telework options for those who can telework from home. Some people won't be able to for various reasons, but the goal is to ensure that nobody receives less than a full paycheck. Once again, new information is coming out every day, so I don't want to go into details about how you'd record that on timesheets and whatnot, but you will know by tomorrow morning because our HR department did say they would get new guidance out. I would encourage everyone who has questions to not hesitate to call the HR department for the county. You can do that. You can leave a message for them. They will get back to you. You can email them. And if you call the COVID helpline, we will be able to get you their information if you don't have it, or go to Mariposa County website and you can find it there.
All right, thank you. There's a couple more questions here about the schools and homeschooling, and I think we covered that, but there's an additional question. Teresa would like to know if we have any plans for kids with IEPs.
So obviously, I can't speak on behalf of the school. I do know that on being in conversations with them, they're very concerned that all the kids get their needs met, and kids are on IEPs for various reasons, and we're working alongside them to ensure. So for instance, if a child normally would have counseling at school and they can't get counseling at school, we're looking to get telemedicine and telephonic options for them to be able to continue their counseling while they're also at home. And so absolutely the school is concerned about it. We are also concerned, so we're looking at all options right now for getting kids and family services.
Thank you. Roger would like to know, are we monitoring the homeless population for possible transmission?
Yeah, so I will say that, and Dr. Sergienko can jump in because he's helped create a lot of these protocols. We're definitely working with our homeless community and our homeless service providers to ensure that we know what to look for, and we've developed protocols in terms of how to sequester folks or quarantine folks who may need to be quarantined based on either a positive test results or symptoms that they may be experiencing, taking all precautionary measures, including social distancing, additional protective gear for folks working at the homeless shelter, additional sanitizer and cleaning supplies. Those are all things that we're doing. There's been some really good guidance that's come down from the state and from the CDC about how to work with homeless communities. We've also set up additional hand washing stations and porta potties. So for folks who have chosen not to go to the shelter and maybe are living in an encampment, we've offered them some land, some county space where they can pitch their tents and then also access hand washing stations and porta potties. So we're encouraging people to practice good hand hygiene and other social distancing precautions in the homeless community. But once again, 966-2000, we're here to support if anyone has any concerns about individuals in the community who may need that help.
That covered everything. I think it would, again, we're as aware of the concerns in the homeless community, knowing that they're an at-risk population, they're immune stressed. There's an older population within our homeless community, recognizing that just age alone is an at-risk population. So they're more likely to have a bad outcome from COVID-19. So we're maintaining a watch on them, ensuring they don't get an outbreak.
All right, the next question comes from Teresa. She says, is there a plan in the future to keep others from outside the county from coming into our county to buy supplies or coming into the county in general. Thank you for all everyone is doing to keep us updated and safe.
That's yours.
Okay.
Ann.
This is Teresa.
Yes.
Okay, well, thank you for the question. So this is something obviously that our community is concerned with and that county government is concerned with also. At this time, there's no monitoring or roadblocks or car stops checking on the stay-at-home order and to identify essential travel. Having said that, again, we're continuing to rely on common sense and all of us adulting at this time. So, I can just assure you we're monitoring that situation. We're continuing to pay attention to it. And if, in the future, there becomes a need to start to protect resources and if they thin, we'll communicate that to our community, excuse me.
I would ask just of people who are, I would ask our own residents, as people that are coming from other counties, especially from counties where there's community transmission, be aware of symptoms. And if you've got that fever, shortness of breath, worsening cough, recognize those symptoms and contact a medical provider. If you don't have a medical provider in Mariposa County, you can reach out to the emergency department at John C. Fremont. And the number for that, I remember, for 966-3631. And then just follow the phone tree down to the emergency department. Or you can call our information line, which is 239-1332, and they can give you the phone number for John C. Fremont.
All right, thank you. Sanda would like to know, are you seeing very many cases of just flu and colds?
Yeah, it's still the flu season out there. And when we were being more restrictive in our testing, I was directing physicians and other providers to test for flu first before we would approve a swab for COVID. And a lot of those tests for influenza came back positive, more lately of influenza A rather than influenza B. And then I will say, there's a rumor been going around that that COVID-19 has been in our community since, say, December, November. And I can say molecularly speaking, that's not the case, but there has been other viral respiratory pathogens out there, including probably adenovirus, that have been setting people back for a bit, in addition to flu and other viral infections out there.
Thank you. Hannah would like to know, if you are self-isolating and test negative, can you still be infected but not have high enough numbers to actually show positive test within the 14-day period?
So let's see, I'm trying to sort the pieces out. So again, let's talk about isolation versus quarantine. So isolation means you've had a positive test. And if you've had a positive test, you have to stay in your isolation for at least 7 days after the onset of symptoms, or 3 days after the fever breaks without fever medicine. If you're quarantining, that is, you've been exposed to somebody, and we have you stay in there for 14 days. If you don't have symptoms during that time, then you're disease free. But getting back to the question again that Hannah had was,
can you still, if you test negative, can you still be infected but not have high enough numbers to show a positive test?
so that would be a false negative test.
Mm-hmm.
Could that occur? Possibly. But again, as I mentioned to an earlier question, we really don't have large enough numbers, and we really don't know the prevalence in the community that would allow us to say what the true false negative numbers are.
Thank you. Okay. Next question comes from Andrea. If you become ill with some of the COVID-19 symptoms, but not all, and recover at home, how long should you stay isolated after your symptoms are gone?
So again, yep, but 3 days after the fever breaks, or for 7 days after the onset of symptoms.
All right. Next question from Dwayne. Will the DMV office stay open for renewal of licenses?
So I can take that one. Dwayne, I understand regarding the DMV department that since California has entered into a state of emergency, DMV is advising people with transactions that need to occur in the office to please make appointment for that only at this time. And they've also identified a 60-day grace period on what I'm understanding to be transactions such as vehicle registration renewals and things like that.
Thank you. Pat would like to know, what about retirees' checks?
That's important.
Yeah, I don't know the answer to that, but it's something that we can certainly get posted in our frequently asked questions that will be coming out regularly. So we'll definitely look for that on our Facebook and our website.
Thank you. Don would like to know, can you speak more to what plans are being made for temporary hospital facilities?
So what I can say at this point again is the surge capacity that we feel we needed will most likely be met at John C. Fremont. But under the governor's executive order is that frees up the fairgrounds as a possibility. There used to be a memorandum of understanding between John C. Fremont and the fairgrounds to use that space as a bed facility. And I suspect that would be our go-to. We need expanded bed capacity.
The county is working on a contract currently with the fairgrounds to have that as an accessible site should we need that.
Okay, next question from Eileen. It appears that homes are still being shown that are on the market. Any plans to ask the real estate community to stop showing homes?
Well, I think we somewhat addressed that earlier in our discussion. Again, things are a little fluid and dynamic right now. If there are such triggers that would require the county and the public health officer to escalate enforcement orders, we'll take that one day at a time. As those change, our PIOs and the JIC team will get that information to the community. So we're all lock and step at the same time. We all as a community understand at what level we're operating in. So thank you.
And again, I think it's a messaging thing, and we're only 3 days into the statewide state health officer's order. So things will, again, tell them, be a good neighbor and say, hey, we have this stay-at-home order in place. Please adhere to it.
All right, thank you. Sabra would like to know, homemade face masks, are they effective and are they safe?
So again, I think I started out the question period with face masks in general. And so there are patterns out there that actually would work to stop droplets. But again, they only work for you spreading the disease to other people, not the other way around. So they won't protect you from someone who's ill, making you ill. But if you're sick, they'll stop your droplets from getting sneezed, coughed, or breathed on somebody else.
Okay, next question from Carla. Will the general community be encouraged or required to be tested when it's affordable? Quick result tests are available to help the spread even further, particularly for those that may be asymptomatic or have mild symptoms but still contagious.
Yeah, so again, the challenge right now is a shortage of tests. I don't see us at the point where we'll have enough tests for everyone in the general public, but I see with probably in the next 3 to 6 months that we'll be able to test symptomatic people. The exciting news from yesterday is that there's another platform coming on for testing that will allow us to do rapid testing within a day. The nearest capability that has that is in Merced and Madeira. And we'll be using those to do our contact tracing and help us, eliminate those chains of transmission. The other thing that I think will be happening in the next several months and is already happening in some of the Bay Area communities is what's called serosurveillance, where you get a blood sample taken to see whether you were sick or not. And that'll allow us to tell how many people really were sick and had mild or no symptoms at all.
Thank you. Teresa, to answer your question, I'm going to read off the information call center again. It's 209-239-1332, and that's from 8 a.m. to 5 p.m. And there's a recorded line at 966-1133 for after hours, and an information email. You can send your questions to mariposacovid19@gmail.com. All right, the next question comes from Karen. There are several new cases in Madera County. Eastern Madera County is one of our closest neighbors. Do we know if the new cases in Madera County are in the valley or closer to home?
They were in the valley, and as I started out the Facebook Live with, is that was a really good example of coordination and cooperation across the branches of government, where the public health department asked for assistance from the sheriff, DA, and probation, and they were able to find all of those contacts of those individuals in under a day. And so I feel comfortable in saying that chain of transmission has been cut off.
Great. All right, the next question comes from Lexi. Are there any recommendations to wear surgical gloves when out in public? Can you address contamination in regard to wearing gloves as well?
So I think hand hygiene is probably more important because there always are risks of cross-contamination when you're donning and doffing. And honestly, the pathogens that you get on your glove, sort of the experiment you want to do with yourself is how often do you touch your face with your bare hand? Imagine touching it with a gloved hand and the easy transmission of the germs that are on that glove to your face, because there is some adherence to skin when it sticks to your skin. So hand hygiene, more important than gloves.
So there's been a lot of conversation in the community, social media about gas handles at gas station. Is that legitimate? Folks should be pretty cautious, or what do you think?
So we know it lives on the environment for anywhere from 2 to 9 hours. And what I would do is have some hand sanitizer available in your car. And after you're done fueling, actually, let's say before and after fueling, a little squirt and rub that until it's dry. That will stop the transmission.
Thank you. Dina would like to know, what does one do if you have symptoms? Contact your own doctor or the public health department?
Contact your own doctor. That's probably the best way to go. And then if that provider, that physician has questions, then they can reach out to the health department.
Okay, Donna would like to know, are tests being given to those with COVID-19 symptoms alone, or to be tested, do you have to also have recent travel to an exposure community or a confirmed COVID-19 patient?
At this point, if all you have are symptoms, we'll test you. Now, again, what I would ask providers to do is look for those exclusionary diagnoses, because we do know that if you've got flu, bacterial pneumonia, some other infection, the likelihood of a COVID-19 infection along with that is close to zero.
Thank you. This is from Ariane. Does Mariposa have ventilators, and if so, how many?
So at this point, we have 3 with the possibility to go up to 5, and we're looking for 2 more that we would either obtain through a private vendor or through the Strategic National Stockpile.
Thank you. Can you explain your role as acting health officer for Madera and Tuolumne counties and how that came about?
Sure. As I think most people know, because I've presented to the board, I've been the acting health officer for Tuolumne since January, and that came about when the Board of Supervisors in Tuolumne relieved the health officer of his position. And we've had an existing MOU with Tuolumne for several years, and so that's been a service that we provided off and on for vacations or extended sick leave. Recognizing that I may be in that acting position for a while, their administrators worked with our administration to establish a little bit more robust MOU where the county was being compensated by Tuolumne County for my services. Conversely, Madera, and I'd ask you to keep Dr. Simon Paul in your thoughts and prayers. He had a medical emergency last Tuesday, sort of immediately after doing the health emergency proclamation. And the health administrator down there made it very clear that it's not COVID-19 related. And I've been able to talk to him since his hospitalization. But at that point in time, Madera was very desperate for a health officer. And so being good neighbors, we stepped up into that role. And then post hoc, we've been working on an MOU to cover for my services and the costs of that. I will say the very positive thing about this, though, is we've got an incredible unity of effort, cooperation, and coordination, not only between the health departments, because I'm the health officer for all three of them, but with the public safety agencies that work with those health departments. So I think we have better awareness and a better common operating picture and a better agility to respond that we wouldn't have were I the health officer of just Mariposa. So I think that actually enhances our mitigation and containment operations.
I agree.
Thank you.
Absolutely.
Okay, Jessica would like to know, is gas going to be rationed?
I don't see that occurring.
Thank you. All right, Julie would like to know, can my kids have friends over?
Yeah, so this is really a good question, and a lot of people are actually asking that. So our JIC team has put together a lot of information. They've put it out on our Sheriff's Department Facebook, public health Facebook pages to be able to share. We encourage you whenever you can to practice good social distancing and isolation. Obviously, kids are not great at understanding what that means sometimes, especially smaller kids. And so we're helping parents through some of our postings to look for different kinds of strategies for having things like virtual play dates, for instance. We do see childcare as being an essential operation, however, and it's something that we're working on as a community. We need to ensure that essential employees and healthcare workers who have children are able to get to work. So we're in the process of working with our childcare community to figure out how to best provide these services. And so it will mean bringing kids together sometimes, but there are strategies that we can put into place. Good hand hygiene again, social distancing, and really ensuring that if a child is showing symptoms or is sick, you make the decision to not actually have that play date. I would just go back to what Dr. Surjanko has been talking about throughout is there are strategies we can do to keep ourselves safe, but for the meantime, if you can just be a good neighbor and practice those tools and strategies and socially distance, that would be best. That being said, from a mental health perspective, we don't want people to feel isolated, so look at some of those other strategies, and this might be a good time for families to spend more time together too. Want to add to that?
I think you nailed it.
All right, thank you. Question from Lexi. Will essential businesses eventually monitor the number of patrons allowed in at one time to encourage social distancing?
So I would ask them to do that. It's not something we've really given guidance out about, but basically, if you think about it from a dimension standpoint, you need about 30 square feet per person to maintain social distancing. So if businesses really wanted to be strict about that, figure out how many square feet they have in their business, that's the number of patrons they could have in it at a time, and encourage those patrons that are in the space to maintain social distance.
Thank you. Joe would like to know, are there plans to enforce the shelter in place, and how is that going to affect our civil liberties?
Okay, Joe. So again, we've kind of combed through this question a couple times, but I think I understand your concern. So at this point, the stay-at-home order is just that. We haven't escalated to a shelter in place, and we're not seeing rigid enforcement of that at this time. But again, we'll communicate with our community if those triggers are met to where we need to escalate. Again, we'll approach this and migrate through it as a community to ensure all of our constitutional rights are protected while still maintaining that we're keeping our community safe, and we'll be able to see the best result with all of that.
Okay, we have time for just a couple more questions. Teresa would like to know, will food stamps be released early?
So right now, there's different regulations coming down all the time and guidance in terms of the SNAP CalFresh program in California, what used to be called food stamps. And I would just say that there's a lot of relaxations coming out in terms of reassessments for that. I have not heard anything yet about food stamps being released early. That being said, we want to make sure that no family goes without food. And so if you find yourself in a situation where you need your food stamps released early, I'm not sure we can do that, but we may have additional tools in our toolbox to be able to get you the food assistance that you need. Please call 966-2000 and we can help you with that.
Thank you. And last question, if we see something that could be a public health risk, who should we call?
Kind of great question. A little broad, but your local sheriff's office emergency 911 center is available 24/7, 365 days a week with 911 and straight business calls. If you have a question on who to present that concern to, always feel free calling the Sheriff's Office Dispatch Center. Our dispatchers are great. They're trained and knowledgeable on where to get your report, specifically to which enforcement agency or support agency to best respond to your concern. So continue to be aware, continue to be observant, and keep the information flowing. That's going to help us at many levels. Thank you.
All right. Thank you to everyone watching that tuned in. If we missed your question, the JIC team will go back through these questions and make sure we get an answer. And we will also create a FAQ page out of this as well. So thank you for tuning in, and thank you, Sheriff, Doctor, and Director. And that concludes our live. Have a great Sunday evening.
Thanks.
Thank you,
Thank you.
folks.
I went for the last hour without touching my face.
My nose itched.